Hi, my name's Jen Barr from Downingtown Nutrition, and we have Becky Wojcik, and we just wanted to pop in and make a short little video about our insulin resistance program that's starting in January because we had a couple emails, little text messages, some calls about questions about it, and we thought it'd be easier just to make this video. So we are starting our program, 12 weeks to reverse insulin resistance, and the one question is, what is that?
Yeah. Jen, why don't you tell us more about what insulin resistance is before
Okay.
we get started about the program?
So you do not have to take insulin to be on this program. That was one of the questions. Insulin's a hormone, just like estrogen or testosterone. It comes out of your pancreas, and when we get older in middle age and we have higher body fat storage, especially around our middle, you're more likely to have insulin resistance. It may not show up in lab work that's routine. Your glucose may be normal, but insulin resistance by nature is higher weight and higher body fat percentage. And what that means is that your pancreas may be working and putting out enough insulin that's keeping your blood sugar normal, and that's great. But for how long? And you might notice that it's like really difficult to lose weight, or if you eat a lot of carbs, the next day your weight goes up like 6 pounds. First of all, that's not real weight gain, that's insulin resistance. So that by definition, that's what insulin resistance is. Does that
And
help?
what does insulin help do in our bodies, Jen?
Yep. Insulin basically helps take glucose and put it into your bloodstream and lower your bloodstream. So over time, if you have too much insulin, um, it's either not sensitive enough or it doesn't lower the blood sugar or it causes a lot of fat storage. So over time, you need more and more insulin to lower that blood sugar and your body just produces more insulin, or your body's not kind of like lock and key taking that insulin to glucose and absorbing it into your blood or lowering it over time.
And what people might be insulin resistant?
So anyone that has a family history of type 2 diabetes, mom, dad, siblings, grandparents, anyone that has polycystic ovarian syndrome, PCOS, if they are um, if they have gestational diabetes, female, you're more likely to have it. If your mom had gestational diabetes, you're more likely to have it. Um, if your blood sugars are slightly elevated, so over 100, one in the teens, you're actually could develop type 2 diabetes. And anyone that is overweight or obese, BMI over 25, has high cholesterol or high blood pressure, or they have more of a belly, like fat in their region, you're more at risk for the insulin resistance. And of
Or
course,
prediabetes, right? So if your doctors told
diabetes.
you that you're in that range of developing diabetes type 2, you'd be
Yeah, and
pre-diabetic. Yeah.
yeah, and we also have, if you've seen Dr. Bruno, endocrinologist from Mainline Health, he did a webinar for us 2 weeks ago, and we had a really great conversation, like literally about this. So it's on our website if you want to rewatch it or any of our social medias. But basically, if we can get you, if your blood sugar was like 101, 110, even 120, if we can get you as registered dietitians and get some lifestyle changes going over the next 3 months, we can actually keep you out of that type 2 diabetes range for like a decade, 7 years. But if we
Wow.
don't and those blood sugars go up, you're more likely to develop type 2 diabetes. Yeah.
Wow. That's really impactful.
hmm So other question is like when is it? Like how much time's taken?
Yeah.
Belly.
Yeah, so the program's 12 weeks. For those of you that are looking to join, it starts mid-January and it runs as a group program. We meet Monday nights from 7 to 8 p.m. on Zoom, so you can join from home or work. Hopefully, you're not working that late, but you never know, or even in your car if you're not driving. And the group support is really amazing. The 12 weeks helps us to go over the nutrition piece, which during the program, you'll wear a continuous glucose monitor that we'll provide through the program registration fee. And you get to see real-time data on what your blood sugars look like. And Jen will help during two of those 12 weeks to guide you on what do those, ups and downs look like, what's going on, what's normal, what's abnormal, and then how to change food, exercise, and also stress. in order to manage that better. We
I
also,
sorry.
yeah, it's so exciting. Yeah.
No, go ahead. What were you gonna say?
Oh, and then I was going to say, you also during that 12 weeks, so we have the 12-week group sections, plus we have the gr meal planning program that's associated with that. That's what I was thinking of, and thousands of recipes that are associated with great ones that you can make at home.
I didn't mean to interrupt you. I get really excited that everyone gets a continuous glucose monitor for 30 days.
Mhm.
Could go a little over that too. But what's awesome about that is we can educate everything: food, diet, exercise, stress, sleep, blah, 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 right? How it impacts your health. When you put that CGM on, by the way, it does not hurt, I promise. And you put that sucker on your arm, that is you. That is your chemistry. And guess what? You can't fake that. Like your blood sugars are going up after you're eating late at night or a stressful drive home, like whatever, like your blood sugar is going up, your phone's like beep, beep, beep. Like that is real time. So what I love about using the CGM is we can make real time changes if we see a couple patterns. Now, if something happens once, but if we start seeing patterns of why blood sugars are high or, why you're cranky or have a poor night's sleep and we can correlate it to your blood sugars, that's pretty impactful. And this is our third year doing the program. And one of the biggest changes that people have, there's a lot of big changes, but one of the biggest changes that I see is people actually end up exercising more as a result of using the continuous glucose monitors because you have this direct effect like, wow, it really makes my blood sugars lower, but I feel better. And I'm seeing that connection with movement. And there's a lot
Mhm.
of other positive changes, right, Becky?
Yeah, we've seen people lower their hemoglobin A1C. I had one client go from being in the type 2 diabetes range down into pre-diabetes, so we lowered it significantly. We've had people lower their cholesterol, their fasting blood sugar levels, they've lost weight, they've lost visceral fat, which is really cool because part of the program, you also get 3 in-body assessments. So it's a scale that we use that we have access to that doesn't just look at the weight on the scale. It actually also looks at body fat percentage as well as muscle mass, as well as visceral fat. So we're trying to get that fat around the organs to be decreased because it is a direct correlation to risk with metabolic disease like cardiovascular and diabetes. And so when we lower that visceral fat, we know that we've lowered the risk of developing those diseases. And that's a really big one. People also have lowered their stress response and have started to eat more fiber from fruits, vegetables, whole grains, nuts, and seeds, and beans, as well as they've significantly like decreased their overall like feeling crappy. They've increased their energy levels. Also, sleeping better is another one that people have noticed too. Anything else that I'm missing, Jen, that people have found to be helpful?
No, it's just that when the program's over, we don't leave you high and dry. We have a lot of programs that insurance covers that we kind of keep you going. We actually have people repeat the program because they liked it so much. People just like
Mhm.
kind of crave that like once a week just to get back into a habit after the holidays and all like being off from work and your routine. Just to kind of like get into the habit of like prepping food, getting into exercise. We're also experts in food and nutrition, so it's kind of nice like if you have questions like, is this good? I saw this on my TikTok feed, or like, no. But it is helpful to kind of have that support over 12 weeks. One of the questions I got for Q&A was, I'm not a group person. I don't think this group program's for me. It's okay. We understand not everyone's a talker in the group, but you may benefit from hearing others with similar struggles, and it may not make you feel alone. And some of my best monthly groups that I run for health and nutrition is the tips that other people actually find help for them in the struggle. So a group, even though you don't have to participate, we also have a community chat feature when the Zoom is off that you continue to have the conversation and relationships for the week.
Yeah. And what I find too is that even if you're not a group person or if you are, we're really educating and giving you useful, realistic tools that you can take home and do at home. It's not just talking at you or lecturing. Like we're really engaging and we make sure that everybody feels like confident and comfortable to do this.
Yeah.
Jen, if I was watching right now and I'm really interested in this program, what would be the costs that I would have to incur to be a
We
part of this?
So we have a $319 registration fee because insurance doesn't cover the in-body scans and it doesn't cover the continuous glucose monitor, and it doesn't cover a few other the education pieces that we have. So it is $319. You can use your Health Flex saving dollars, HSA dollars for that before it runs out by the end of the year. We have 12 group sessions that are run virtual that we do use insurance for. Insurances that I know cover and is virtual is Aetna, Cigna without the U prefix, usually Highmark, Anthem, like Blue Cross Blue Shield, United, if I didn't say that. And ones I know that aren't covered are Medicare, Personal Choice, Keystone Health Plan East, and Independence Administrators. But that's okay because the only thing that's really not covered is the group, and it's only $30 for the group. And I'm happy to use HSA or Flex dollars for that for bill it ahead of time for the year before if that helps you. And you only pay for the ones that you attend. So it's not awful. And we try to work around it. And I'm happy to give you the codes if you want to check your insurance. But, if you have any questions specifically, it's Jennifer@downingtownnutrition.com. You can go to downingtownnutrition.com and just click on the program and there's a questionnaire and I can just give you a call if you want to figure that out. But it's definitely worth the investment in you. We can break it down monthly if you need to make the cost like $100 per month. That's 100% fine.
Yeah, Jen does a really good job working with anybody when costs might be something that prohibits them from being a part of this because we want you all to create a healthy lifestyle and do it through nutrition and movement, and we can really help you do that. So just to summarize, it sounds like the program starts with me January 12th, 2026. It runs 12 weeks through the end of March. Part of that program are also some guest speakers, and the participants come to those 12-week online sessions. Plus, they get the in-bodies, three of those during the time that they're in the program, plus the meal planning app, plus a month's worth of CGMs, which is usually two sensors.
Mhm.
Did I miss anything, Jen?
I don't think so. We do work with your doctor.
Hmm.
We are medical, right? Medical nutrition therapy. So we often will send like a note. Becky will meet with you before the program starts because we like to collect that data and make sure that it's helping you. And we also work with Dr. Parvestan at Integrative Health if you don't have a PCP, and she's happy to help order the labs and use your insurance that way. So if you don't have a primary care, we absolutely work with your primary care doctor on this because we want to help you get out of this risk. And if you don't have that doctor, Lisa Parvestan, Integrative Health has been wonderful to take on new patients, and you will get an appointment with her. So that's wonderful.
Yes, physician support is really important during this journey.
Yeah, so because if your labs were abnormal, we found something. We are registered dietitians. I am a certified diabetes educator, but it is really important for us that if something else is going on, that there's a doctor involved.
So if people are on the fence and they're trying to figure out what they should do about being a part of this program, what would you suggest would be their next step?
I think fill out the form, the questionnaire, ask your questions to me if you're unsure about your insurance. I probably know the answer to that. If not, we can call your insurance and figure that out. If cost is the factor, we can figure that out. But definitely just do it. It's worth it. I mean, if you broke it down per month, I mean, I would say how much would you pay to have normal, healthy lab values? And what the heck are we going to do in the Northeast from January to March, right? Curl up,
Yeah.
get a blanket, like learn, invest in yourself. One of the things is, how I can't tell you how many programs I've signed up that've been like self-guided, and I'm like, oh, this is great. I'm going to do this program, and I don't. I don't look it up. Why? Because I'm not making a date with myself like every Monday at 7, like you would meet with Becky. So take once a week, 12 hours for the next 12 weeks, starting in January, and invest in yourself. Use that time. Like think of it like going back to school, but for you and your health to improve it.
Yeah, I love that. It's so important to invest in our health and think about how much money we spend on like eating